Yeah, I can just see that, there's a crease in here, and this is smooth on this side. Okay, figure this out. Get it all straight in my head here. Any pain when I do this? Pain?
No.
All right. Pain? Ooh.
Just a little tense. Feel it in my lower back when you do that on the right side.
Okay, and how about on this side?
No, not as bad on that side.
And then how do I do that?
No.
Same thing. Tense again?
Not there, but a little further up it will get tense.
And how about if I do that?
No.
All right. I don't think you're too bad, but it's...
He went to the spine center for like 6 months for treatment. They put him on the stretcher machine, whatever that, I don't know what that's called, and then did adjustments weekly on him for that, and then he didn't have problems for a long time. So, what?
He's got a PI ilium over here. Do you feel more restriction here than here?
Yeah.
See that? See, that's higher. It will feel like this is higher up.
Yeah.
And this side just kind of glides and rotates. And then when I look at your feet, not much movement here, and then, whoa, lots of movement. So you're just restricted more on this left side, and I believe that's causing irritation over here on the right. So I use the massage kind of as an evaluation. You don't seem too ticklish.
On my shoulders it was pretty
Right here?
pretty gnarly right there. Yeah, that hurts. Really bad.
He won't even let you
Yeah.
touch him.
Ow. Yeah, I don't like that.
Sorry. You're getting
Suck
goosebumps.
it up.
Yeah, it
Here we go.
hurts.
Here we go. You got some scar tissue, major scar tissue here underneath your shoulder blade. Come on. Two more, and you're done.
Yeah, just breathe.
One more. Done. There it goes. Good. Over. Other side. And you'll be done. You can see his spine reacting to it already.
Mm-hmm.
Come on. One more. It's done. Done. All right, good. Don't have to do that again until the next visit. If there's going to be a next visit. Done, all right. You're like, I don't like that.
Yeah, that hurts too.
If it doesn't hurt, then I'm on the wrong spot.
Yeah.
Okay, here we go. You can see how it's pulling here. All right, there it goes. Done. There's one. See, I told you I get it. Are you sure you don't? I'm gonna miss these if I don't pull the mic closer. I thought you said you don't crack.
Yeah, I usually don't have a massage going on. It's like my shirt's still on, and I was pressing one time.
I'm like crack.
Do you want me to bring the mic closer?
You're gonna have to. I don't care if it's in the way. Here, you ready?
Yeah.
Good. See that? You're not that hard to adjust. Do you feel it in your stomach?
Mm-hmm.
All right, be careful then.
No, not too bad.
I gotta get this other side to go too. There it is. All right, take a break. Breathe, keep breathing. You're doing good. I'll warn you when I adjust you, okay?
All right.
It's coming back in. The disc is going back in. You're doing good. I know. Ouch. Massage is worse than the adjustment.
Breathe through it.
You're okay. All right. Relax. I'm trying to loosen up these muscles, okay, so that I can create space so that disc can go back in. This is why the disc is popping out. All right, I've got to create like a little hole for the disc to get reabsorbed back in. And the only way that it's going to do that, because right now your disc is saving you from, you know, I don't want to make it sound scary, but your disc right now is saving you from being paraplegic. So I've got to create space so that your disc can go back in. And it doesn't feel good. So when people ask me, is this massage?
I bet your hands don't feel good at the end of the day either.
They're all right. I think it just hurts you worse than it does me.
Yeah.
I don't feel a thing. You're the one that feels it. You'll be better in a little bit. You'll be okay. You're doing good. You're doing good. There it goes. Okay. All right. I actually want to use a scraper. It doesn't hurt. It doesn't hurt. But I think that's really all he can handle right now. He's just ultra stressed and ultra a lot of tension in here.
Mm-hmm.
Again, what do you ride, a skid steer?
Yeah.
How many hours a day?
At least 8, but I work 10 to 12, so I'm in the machine
Yeah, that is just really
more
hard
than
on your low
3/4
back.
of the day. It's got an air-ride seat, but they won't give me the undercarriage that I like, which is
That's not good.
a track system that has suspension on the roller.
You want to get this, Linnea? This is pretty gnarly back here. Gnarly. Sorry, I didn't warn you. On the rat. That's probably the worst scar tissue right there. On the left-hand side here. You're getting goosebumps again. You okay?
Yeah. I know I feel it when I play guitar too long standing up with the guitar on the strap, and I notice like my posture is lean way down, and we did some yoga the other night, and I noticed it right away, just straighten up, and then when I got in the recliner or sat down at all, I didn't want to slouch at all. My body didn't want me to slouch at all.
Yeah, you slouch, you'll pull that disc out.
Yeah.
Yeah, you can't do that. You can't bend over. You can't slouch. No, just leave that alone. All
Well,
right.
I noticed when you went over that just now, it doesn't feel like it's horribly painful to the touch as it was when I first.
Was. Yeah, if I
when
can
I
get
first
this
came
mid,
in.
if I can get this mid back to move, this will loosen up. You know, think about this here. Yeah, see this rib is out, and that's going to cause you problems in the low back. It's just pulling tension on this low back here.
Yeah, it's hard to do deep breaths when we're doing yoga at the house. It feels like it's just so tight.
Yeah, this is something else down
So
here.
when you go in for an adjustment anywhere else and they just go, they don't do any prior therapy beforehand, is that worsening the scar tissue that's there? It's already built up?
No, it's
No,
just
it's
not
just-
doing much. That's all. It's just probably not doing much of anything, unless
Yeah.
they're really forceful and they really like crank on you, and then something gives that shouldn't give. Like usually a weaker area.
Mm-hmm.
You know, the scarred up areas aren't going to move. It's the weak areas that are going to move. It's the ones that are healthy that move before the scarred tissue
Right.
moves. So I go in there and I check everything first, make sure it's all loosened up, deliver the adjustment as safely as possible, leave it alone. You gotta let the body do its thing, and you're not gonna feel better right away. I mean, yeah, you're saying you feel some help, but really that's just this disc going back in. But guess what? As soon as you take a couple steps,
Yeah.
it's gonna pop back out. So it's gonna take me a little bit. Yes, but I think you know where you gotta go. I think you know you gotta be in an arch. You gotta have a curve in this lower back.
So she's saying to do the roll.
Yeah, as much as you can. I mean, it's kind of painful when the disc is hanging out there.
Yeah.
You know, when the disc is hanging out towards the back, it's hard to do the foam roller.
It's hard for me
Because the
anyway.
disc is just pinching it. It's just getting
Yeah.
squashed. But if I can get the disc to suck back in, and he can lay backwards, and there's no disc in the way. That kind of, I know
Yeah.
it's easier on a model to kind of explain that. Oh, I'm sorry. I need to like warn you every time I do this. It's like, I'm sorry. Here I come. I'm coming. All right. Jeez. A lot of congestion in here. A lot of congestion in the lower right here. The bruises will go away in about 4 days. That's usually when I tell you guys to come back in. It's hard. How old are you again?
32. I feel like I have an 80-year-old back sometimes.
All right, deep breath in for me. All the way out. Let it all there. Excellent. Other side. Here we go. Deep breath in. All the way out. Let it go. Let it go. All the way out. Ooh, you made it. Can you see his back real closely here? You know, this is just where he's really tight. He's having this, not sure if you can see the left side here, that's kind of, it's starting to come back in and pull this side over and pull that disc back in there. He's real ticklish, so I'm not able to do too much, but it's pretty good for his first time, I think. Hopefully we've just created space in here for this disc to kind of go back in. So let's adjust the low back. Here we go. Gotta be real careful here. Here we go. Any pain when I do this?
No.
No, you're all right. I need the shoulder to come down. That's it. That's it. Now you're gonna arch yourself back as far as you can without causing too much pain. That's it. That's it. You got it? You all right?
Yeah.
Okay. Any pain when I do this?
A little bit in my
Mid-back?
It feels like I'm cramping up.
All right, all right. Just relax, relax. Stretch first. Stretch. Just take it easy. Is it still cramping? Let this arm go. Let this arm go. I know, it's just you haven't had this kind of, I feel like nobody's been really patient with you here.
Yeah.
You probably just do it and get it over with.
Yeah,
and
put
like,
me on the roller bed and then
like, what the heck
15
happened
minutes,
to me?
Hear the dinger and then give me the ringer dinger.
All right.
No, they don't actually do the towel thing. I've seen that. That's pretty scary.
They're trying to get me to do it too. I said, no way, Jose.
Still cramping?
Mm-mm.
Okay, here we go. Still cramping?
Mm-mm.
Head back. Look towards the wall. That's it. Here we go. Ready? There it is. All right, done. Other side. Same thing. Let's stretch again. Back, back, come on back. That's it. Is it still cramping? Stretch, stretch. Cramping still?
Yeah, a little on my side.
All right, stretch, breathe, breathe. Breathe, breathe. Breathe through your rib cage. That's it, that's it. Let me know when it lets go or if it lets go.
Yeah, that's good.
All right, here we go. Back, head back. Ooh, shoulder. No, head back for me. Up, yep. Pain?
Mm-mm.
There we go. Breathe, let it go. I got you, I got you. It's okay. It's all right. You do okay? You made it?
Yeah.
All right, on your back. Take a break. I gotta work on that SI joint. Hey, girl, let me work on that SI joint, or is it not gonna happen today? Here we go. Good. What's going on with your wrists?
Constantly tired from operating the machine with the joysticks.
This all day.
I can do like this and just pop them all the time. I can do my elbows too by myself.
Not like that, can you? 'Cause that's
I
not good.
I have to
Like unlock it.
flex and then it goes. I can do it, but I was gonna let you do it instead. Yeah.
I feel better. Okay, thank you for that. That feels good. It's just, see that? That's
Yeah.
just tension. That's just scar tissue.
Yeah.
You know, when you use something over and over and over again, it's going to develop that scar
Yeah.
tissue, and that's what that crunchiness is that you're feeling.
Yeah. I mean, I normally wouldn't be able to just lay flat right away.
So this is an improvement.
Yeah.
Okay. If you want to bend your knees, sometimes that takes the pressure off of your low back. You feel free to do that, okay? So no neck pain though?
Mm-mm. Just kind of tight.
Tight on the right hand side, huh?
Yeah.
Yeah, I feel that. Got a little bit of a restriction here. You're all right. Just breathe. This is where I'm headed with the adjustment. There it goes. All right, give that side a break. Go to the other side. Let's see what I find over here.
Right side definitely feels worse.
Yeah. I did the worst side first. Come on.
Mm-hmm.
You do have a little bit of a knot at the base of the cervical spine here around C6, C7. And that's common. Just typical right atlas. And the compensation is in the left shoulder region. Just that sitting all day is just in that skid steer. And there's no other options.
Not unless I get a remote control for it. They make them. You can stand outside the machine and it
How much
operates.
does that cost?
Oh man, it's
Oh my
probably
gosh.
just as much as the machine, I'm sure. $70,000.
All right, we'll get you there. And just know that when you sit in those things, it undoes all of this. So it's not to say that I can't help you. It's just that it's a slower process. It's like 2 steps forward, 1 step back. Yeah, you're going to feel better after this, but then as soon as you get in there.
Yeah.
So I've got to retrain your whole body. I almost want you to wear
I
a
wish
low
it was
back.
Friday.
You can wear a brace.
Wear a brace in your low back tomorrow.
Yeah, I probably should have today. And
It's the
For the
only
whole
thing
week,
that we
really.
can do until it
Yeah.
heals, until that mid back learns to take some of the shock out of the machine.
right.
Right now your mid back is on guard and your low back is doing all of the shock absorption.
Yes, overcompensating for
Exactly.
that.
And we'll get it. It's just going to be a little slower than, somebody that doesn't have to work for life.
Yeah, the people I work, the houses I work on.
Yeah.
Yeah, but it's not, you don't have that luxury, so I got to get you up and going. Just know that it's not going to be right for a while, but it's okay eventually, like in a week. It's not going to be the next few days. This is what I did all day long in North Dakota. Guys, and skid steers, oil rigs.
Yeah.
And they go, what do I do? I'm like, I'm just going to patch you up, send you back out, come
It's
back
harder in
whenever
the
you
cold
can get
too.
it. Well, it is and it isn't, But, and I would sell these low back braces and they would come back in like in a week and they were still wearing a low back brace. So take that thing off when you're like sleeping and when you're doing your just when you're in the skid
Yeah, they
steer,
say it'll
put 'em
make
on.
you weaker
Yes,
if you keep it on.
My
Yes.
dad wore one for a year straight.
Because you're used to it.
He's
Right.
already like,
Yeah, no, take that thing off when you won't be able to digest.
It's like pinching you.
Mm-hmm. There it goes. Excellent. All right. Resist the urge to do more. It's like I want to Megan's like,
They get on to me about that at work too, because they're like, you're too much of a perfectionist. And I'm like, well, it doesn't take me any longer to do it the right way than it does for you to call the guy who did it the wrong way the first time to have to come back and fix it, or me come back and fix it again. Yeah, I'm not used to massages at all.
I can tell.
I'm pretty knotted up.
If he's gonna pop, but we'll see.
Yeah, my neck usually
It does?
is the best, yeah.
Alright. We'll see. Okay, here we go. Chin back for me. Ooh. Way back, you got it. Excellent. Other side. Breathe. I got you. Yeah, you've got it. You're lowering that shoulder down. Good. Excellent.
Yeah, you gotta drop your shoulders.
Yeah, you do that. Toes. Legs.
Yeah, I can pop my own toes.
No, that's right.
But I don't like to pull them, I like to...
Crunch
oh,
them.
that's what he does
Yeah.
with his fingers every day.
I've got caught.
I don't do it. She just.
It's okay. I don't care. You can't really
Is it reverse
hurt the.
thing?
Mm-mm.
Yeah, it's just air.
No, I haven't shown any kind. There's no research that doing that hurts you. So I just let people do it because it feels good.
tap it too.
Ooh.
It's so weird. I feel like I'm gonna pull my tail
This would be
off.
like the blooper reel.
Yeah.
Silence on set! Quiet on set! Alright.
Scary.
I'm not gonna pull your toe off.
It feels like it's gonna dislocate or something.
Have you ever dislocated your toe?
Yeah.
Which one?
No, I have dislocated my thumb.
Well, that's the thing. It's like, alright then.
I'm
Thank
10
you.
for 10. Big toes don't really want to go. What does it feel like? Can I go harder or is that about its limit?
No, you can go harder, I think.
Nah, that's about as much as I'm gonna go. That's all I got. That's all I'm willing to go. There you go. Now, this part you gotta let me know how bad it hurts. When I do this, I kind of do a straight leg raise. I'm testing how bad his low back is. Does it hurt?
Mm-mm.
How about now?
No.
Nothing? Of course, I did just adjust. Any pain when I do that?
Mm-mm.
I was about ready to crack it. But I'll slide right off. Gotcha. Good. Any pain when I do that?
Mm-mm.
I think you're better already. Yeah, I don't think you'd be able to do that if you had a true. You could not let. Well, let's. I shouldn't speak. Let's do the left. Any pain?
No.
You're gonna live, I think. There it goes. Excellent. There it goes. Reach overhead, grab the table for me. Yeah, both hands. No, I got it. There it is. Trying to stretch that low back. All right. And the knee. Any pain when I do this? Good. All right, come on and stand up. Let's see how it feels. Roll to your, okay.
Okay. Yeah.
You can do that too.
That would have been the better idea.
You must be doing better if you can do that.
Yeah.
All right, now my goal with this is to get you to be able to do this
Mm-hmm.
without any pain.
Yeah.
Can you?
Yes.
Chest out. Right there. Head back for me a little bit. That's it. Okay, so when you're in that, yeah, that takes the pressure off of this.
Mm-hmm.
Now, you try to do the roller before this, it just doesn't have the flexibility. So now you should be able to go do
Yeah.
the roller without as much problems. I'm going to do a little bit of the dinner roll today. Come all the way back. Yeah, there you go. Now, pain in your low back?
No, it's just kind of tight in my mid back, right where the.
I don't care about that too much. This low back is what I'm worried about right now.
No.
Okay. Yeah, I want discomfort here. I'm trying to open this up.
Yeah.
But your
It's
leg-
better with as I stay here, but right at first it feels like I do when I lay down at night.
It's just
It's
really
tense,
stiff
yeah.
and tense. Yeah. You've got to let this part go. Because right now your lower back is doing all of the work for your poor spine.
Yeah.
We've got to incorporate this. It's not designed to do it that well, but it can with stretching and
Yeah, it makes
persuasion.
sense.
But it's not really designed because it's designed to protect all of your organs,
Mhm.
your heart, your lungs. It just doesn't have the flexibility that the low back does. The same thing goes for the pelvis. Okay, so I've got to get this to open up and take some of the pressure off the low back. When we create a curve in the lumbar spine, the disc is able to go back in between the vertebrae. But I couldn't have done this right off the bat
Yeah.
because the disc is in the way. So I've got to do the massage and the adjustment, get the disc off of the spinal cord. Then I can go and curve you over this thing.
It also helps to relax too, because when you said that, I noticed when you said my lower back was overcompensating, I kind of relaxed for a minute and then let the block in the middle of my back kind of just be as it is.
it's hard. This looks easy, like he's just laying down.
Yeah, you wouldn't think about it, but
No, I-
once
yeah.
you're there and you're thinking about it, then it kind of makes sense.
Now, I'm going to take you off just because I don't feel comfortable
Okay.
leaving you on here. Now, you're not going to do a sit up. You're going to roll. It's going to hurt coming off.
Yeah.
But you're okay. Breathe. You're all right. And now come
Stay.
back. Just come back to your back. Hey, you did it. That's intense.
Yeah.
This little silly little thing. Okay. Yeah. It looks so innocent, and then you try to get off of it. Ah. All right, now come on and stand up. Roll on your side. Do like a cat-cow. Test it out. There you go. Careful, careful. That last 15 degrees is what gets you, right? Oh, you did all right.
Yeah, that wasn't bad at all.
I think you're gonna live.
Yeah, I think so. Thank you.
Come on and stand up straight for me. There you go. Now you can do this, okay?
Yeah.
You were not doing this when you walked in.
Yeah.
So step 1, yay, achieved, okay?
Right.
All right, yay! Rest.
Yeah.
Yeah, food. You
I feel
got
like-
it. I'm going to show you some general stuff.